All right. It's just about the top of the hour in which we'll begin. Just waiting for everyone to get logged in. We'll begin shortly. Hi, welcome to our webinar, Managing Anxiety During the Pandemic. I'm Marshall Abbe, licensed independent social worker with the Relationship and Intimacy Center. Just a brief disclaimer. This webinar is not intended to be a substitute for or serve as an alternative to medical or other healthcare diagnosis and treatment when a medical or mental health condition or illness is present. If any of the content in this webinar is triggering or you feel unsafe, please seek the advice of a mental health professional or other qualified health providers with any questions you may have regarding your condition, or in extreme cases, local emergency services. A little about myself. I'm Marshall Abbe, licensed independent social worker. I received my master's of social work from the University of Northern Iowa. I began my professional experience in forensics and community mental health in Fresno, California. I then moved back to Des Moines, where I worked in community mental health and currently practice with the Relationship and Intimacy Center. I'm trained in and completing certification in both EMDR and schema therapy. Both are trauma modalities. And I offer schema therapy for individuals, couples, and groups. So, coping with anxiety during the pandemic. The pandemic has seemed endless. I know when it first began, I was working in community mental health, and it was quite a struggle for me and my colleagues, as well as everyone else kind of in the community, with coping with these issues. And that's why I wanted to make this webinar today. The pandemic has really impacted our core emotional needs. And today I'm going to be utilizing some concepts from schema therapy so we can better understand our core emotional needs, how our core emotional needs are blocked during these times, how they've been most impacted. We'll be looking at 3 basic needs in this webinar, and we'll be looking at some techniques that will hopefully be helpful to you. I've used a lot of similar things with clients during these trying times, and I wanted to find some techniques that I could share with you today. In December, there will be actually a full workshop with more emotional needs and techniques, so we'll actually go a lot further in depth into that, and I'll talk about that again later towards the end. So the pandemic, it impacts our core emotional needs. Today, we'll look at the core emotional needs from a schema therapy perspective. The first core emotional need is a sense of safety and being securely attached to others. That is feeling connection and belonging, feeling heard and understood, feeling empathy, feeling acceptance. And often these are impacted during the pandemic. The next need is a sense of self-identity and competency and autonomy. That is understanding who we are, how we perform the life skills we need to keep our families and ourselves happy and healthy, as well as our autonomy, which is our ability to make our own decisions, which again, during these trying times, makes it very difficult making the choices we want and need and keeping our family and ourselves safe. We have a difficulty with expressing our feelings and needs and getting them met. Our ability to play and be spontaneous is impacted. A lot of our recreational activities and things we used to find enjoyment with are limited. We may not even have access to some of these things, which can make us feel very over-vigilant. It can keep us kind of focused more on what's not in our control. Again, we'll be looking at that a little bit deeper. Finally, limits and boundaries. Having appropriate limits and boundaries is also an issue that tends to happen during the pandemic. So first, we're going to look at core emotional needs as it relates to the pandemic. I use Ekman's model, which is one of the most up-to-date researched views on our core emotional needs. And there's a website, the Atlas of Emotion, that you can go to dig deeper into some of these emotions and the ways we cope. And I'll be talking about them briefly today. So fear is obviously one of the biggest emotions we experience during the pandemic. Our fear of danger lets us anticipate threats to our safety. We adapted as hunters and gatherers. So if we saw a saber-toothed tiger in the field, it would help us to fight or avoid that situation. So we typically respond in a fight or flight to fear. With being able to hesitate or avoid a conflict is an adaptive response. And then we evolutionarily evolved to seek support from our pack. So when we feel fear, it's helpful sometimes to hesitate or avoid the situation. And more importantly, being able to seek support so that we can feel safe, so we can reunite with our pack. Again, it hasn't always been the easiest to do so during the pandemic. We end up coping with fear in poor ways like ruminating and worrying, withdrawing and freezing. And really, this one is kind of a big one. And so, again, it's so important that we do seek the support of others. Sadness is another big emotion in the pandemic. It's caused from a response to a loss. And feeling sad allows us to take a time out and show others that we need support. So again, we may feel sad, we may feel alone during these times, kind of grieving the life we don't have anymore. And if we're not coping properly, again, rumination, worrying, withdraw, and freeze can be typical responses. So it's important to know, again, what are the correct responses and what are not, so that we can make better choices. The feeling of disgust is very evident in our lives during the pandemic. We feel disgusted by what is toxic to us, and that helps us to avoid or withdraw from that toxic situation, which evolutionarily was physically, but now in our modern times, we feel disgust socially. We feel disgust in the news and all of the kind of negativity that has come out of the pandemic. Again, avoiding and withdrawing from things that make us feel disgusted can be an adaptive response. Whereas sometimes if we're not coping right, properly, we may feel dehumanized. We may dehumanize others, treating others like they're not human, depriving positive aspects, personalities, and spirits to one another. Again, during these times, we find ourselves really pitted against one another, and this can be very toxic, which leads us to anger, another big emotion we experienced during the pandemic. This occurs when something blocks us or when we think we're being treated unfairly. Anger can have a healthy response in which we assertively set limits and boundaries. We kind of ask for our needs to be met. And again, if we aren't coping the best, sometimes we'll become passive aggressive, or we'll simmer and brood and quarrel, dispute and insult. And again, I think they're really related a lot to disgust again, these being big emotions that we feel during these trying times. Lastly is joy, the feeling from novel and familiar experiences. Again, the pandemic may limit our ability to find joy in the activities we used to do and feeling connection and belonging with one another. So today we'll kind of dig into how we can reduce some of the negative emotions and connect more to joy. Joy, again, contains feelings like peace, ecstasy, and compassion. And again, these are some virtues that we'll be talking about a little bit later as far as compassion goes. Again, joy helps us to engage and connect with people. And there also is a negative response, of course, to that, and that is overindulging and sometimes even gloating. So kind of thinking to yourselves, which emotions have I experienced the most during the pandemic? And we'll kind of go from there into some ways we can resolve some of these. We'll look at the core emotional need first of secure attachment and connection to others. This is the need to have secure, safe, and loving, reliable bonds with at least one or more attachment figures, whether it be a relationship, whether it be a friendship, whether it be a family member, just basically feeling that we have a nice bond with them. We feel connection, belonging, stability, protection, nurturance, affection, safety, empathy, and acceptance. Going back to the emotions again, if we feel fear, it's important that we are able to reconnect back to the people we have in our attachment, to feel a little bit of stability, to feel the safety. With sadness, again, we want to be able to connect to get comfort, so that we can feel empathy, so we can have some acceptance. The pandemic really impacts these needs as we feel alone, as we're unable to socialize the way we used to. Today, we're going to first work on a meditation that I hope will help us to feel more connected, to feel more belonging, to feel more compassion, to feel more love. It's the loving kindness meditation. I'm going to be reading off a script here. So if I look off, that's kind of what I'm doing. I will invite everyone to get comfortable in your chair, wherever you're sitting. Some may prefer to lie down, some may prefer to stand up, whatever is most comfortable to you, whatever position and posture makes you feel more comfortable. Usually if our spine is straight and erect, this meditation tends to have the best effects. So I will ask you to, or invite you to get comfortable in your chair. We're going to first start by either closing our eyes or maybe finding a fixed point in the room that we can look at, maybe down on the floor. We will put our feet flat on the floor, again, with our spine straight, relaxing our whole body. Again, keeping our eyes closed to the visualization or having them in a fixed point without straining or concentrating. Just relaxing and gently following these instructions. We're going to first focus in on our breathing, taking our mind away from all of the stresses and struggles of the pandemic, and just simply bringing our attention first to our breath. When we breathe in deeply from the belly. When we breathe out nice and slow through our mouth. I will invite you to continue to breathe in a way that is comfortable for you in this way. As I read through the instructions of this, you kind of can follow along. We'll be doing a little bit of imagery where we'll imagine some people in our lives that are compassionate, that are caring, that we would imagine wanting to be in our corner if we were having these struggling times. This may be someone you've met before, a mentor, a teacher. This may even be someone you look up to or admire that you've never even met. Keeping your eyes closed, think of a person who loves you very much or has much love to give. It could be someone from the past or present, someone still in your life, or someone who's no longer there. It could be a spiritual teacher or guide. Imagine that person standing on your right side, sending you their love. That person is sending you wishes for your safety, for your well-being and happiness. Feel the warm wishes and love coming from that person towards you. Now bring to mind the same person or another person who cherishes you deeply. Imagine that person standing on your left side, sending you wishes for your wellness, for your health and happiness. Feel the kindness and warmth coming into you from that person. Now imagine that you're surrounded on all sides by all the people who have loved or who you have loved. Picture all of your friends and loved ones surrounding you. They are standing, sending you wishes for your happiness, well-being, and health. Bask in the warm wishes and love coming from all sides. You are filled and overflowing with warmth and love. We then begin sending loving kindness to loved ones. Now bring your awareness back to the person standing on your right side. Begin to send that love that you feel back to that person. You and this person are similar. Just like you, this person wishes to be happy. Send all of your love and warm wishes to that person. Repeating the following phrases silently, and I will read them out loud, and then we will have a pause, and you'll speak these silently to yourself 3 times. May you live with ease. May you be happy. May you be free from pain. May you live with ease. May you be happy. May you be free from pain. May you live with ease. May you be happy. May you be free from pain. Now focus your awareness on the person standing on your left side. Begin to direct the love within you to that person. Send all of your love and warmth to that person. That person and you are alike. Just like you, that person wishes to have a good life. Repeat the following phrases silently. Just as I wish to, may you be safe, may you be healthy, may you live with ease and happiness. Just as I wish to, may you be safe, may you be healthy, may you live with ease and happiness. Just as I wish to, may you be safe, may you be healthy, may you live with ease and happiness. Now picture another person that you love, perhaps a relative or a friend. This person, like you, wishes to have a happy life. Send warm wishes to that person, repeating the following phrases silently. May your life be filled with happiness, health, and well-being. May your life be filled with happiness, health, and well-being. May your life be filled with happiness, health, and well-being. Next, we send loving kindness to a neutral person. Now think of an acquaintance, someone you don't know very well and towards whom you do not have any particular feeling. You and this person are alike in your wish to have a good life. Send all of your wishes for well-being to that person, repeating the following phrases silently. Just as I wish to, may you also live with ease and happiness. Just as I wish to, may you also live with ease and happiness. Just as I wish to, may you also live with ease and happiness. Now bring to mind another acquaintance towards whom you feel neutral. It could be a neighbor, a colleague, or someone else that you see around but do not know very well. Like you, this person wishes to experience joy and well-being in their life. Send all of your good wishes to that person, repeating the following phrases silently. May you be happy. May you be healthy. May you be free from all pain. May you be happy. May you be healthy. May you be free from all pain. May you be happy. May you be healthy. May you be free from all pain. Sending loving kindness now to all beings. Now expand your awareness and picture the whole globe in front of you as a little ball. Send warm wishes to all loving beings on the globe who, like you, want to be happy. Repeating these phrases, just as I wish to, may you live with ease, happiness, and good health. Just as I wish to, may you live with ease, happiness, and good health. Just as I wish to, may you live with ease, happiness, and good health. Take a deep breath in and out. Add another deep breath in and let it go. Notice the state of mind and how you feel after this meditation. Again, we often ruminate about feeling disconnected, about feeling alone. We don't always seek support or grief with one another. We feel afraid. We, again, ruminate or avoid instead of seeking support. And it does leave us kind of imagining and picturing kind of the worst case scenarios. And this meditation really helps us to reconnect back to the qualities, strengths, and virtues that we hold that helps keep us connected. So I hope this meditation was helpful for you today. Next, we're going to look at the core need of sense of identity, competency, and autonomy. This is the need to feel supported over the course of growing up in moving from helpless to dependence to a sense of competency and autonomy. So we are born and we need to learn the skills to survive, to stand on our own 2 feet, to have a sense of mastery that we can do things on our own. Autonomy being something that we have a choice to make decisions in our life that goes along with our sense of self. With that sense of self and identity, we learn to have emerging tendencies and natural inclinations. Again, the things that we like to do and want to do and find joy and enjoyment in. The pandemic has really affected our ability to make choices. We don't always feel like we can control what's going on. And again, the more we ruminate about that, the more we fixate on that, the more fear we have, the more sadness we have, the more anger and disgust we have. The next technique we're going to talk about is the strengths and virtues reflection. So there are a few of them online, and this was studies that was done through positive psychology that kind of shows that we as people all have these innate qualities, these strengths, these virtues or values. Some of these words are kind of interchangeable. The source that I use today is from the VIA Institute on Character, and it's a strength survey. And you can actually go and you can do the survey, and it can help you determine what your top strengths are. Today, we're just going to read through the list, and if you'd like to just write down maybe 5 of the top strengths that you feel are most resonant with you. Again, these strengths help us to see what is in our control and make decisions that are more in line with what we like and enjoy and find value in. So I'll read through the list. The first virtue is wisdom, and the strengths connected to that are creativity, curiosity, open-mindedness, love of learning. The virtue of courage has the strengths of honesty, bravery, persistence, and zest. The quality of humanity, or the virtue of humanity, rather, is connected to the strengths of kindness, love, and social intelligence. The virtue of justice is connected to the strengths of fairness, leadership, teamwork. The virtue of temperance is related to the strengths of forgiveness, modesty, prudence, self-regulation. And lastly, the virtue of transcendence is related to the strengths of appreciation of beauty, gratitude, hope, humor, and spirituality. So everyone has their own innate inclinations and things that they like and enjoy. It's based on their temperaments, based on the environment they are brought up in, the values that the attachment figures and the people in their life instilled in them. So not everyone will find their strengths or virtues being the same, and that's why it's really important to understand which really are our top strengths. So now that you've kind of identified some, we can kind of look at life, and when we feel we're stuck in a loop of kind of feeling things aren't in our control and feeling like we don't know what to do in life, feeling maybe lost, we re-examine, our strengths, and we see, how am I utilizing my strengths in this situation? Or maybe how could I stop and make a pivot to do something else that is more in line with my strength? And again, we find ourselves in anger and disgust towards others. We may use our kindness, our compassion, our leadership to help us make better decisions or reconnect with people that are more in line with our values. The creativity, open-mindedness, love of learning, can really help us to see the greater things in life that we can find enjoyment in, and can just really be really reflective when we do know what our values, strengths, and virtues are. And again, you can explore this further through the resource that I've shared with you. Lastly is play and spontaneity. This is the ability to be spontaneous, to balance work and play, to imagine, as in the possibility of all positive outcomes, to be forgiven when making a mistake. The pandemic has made it very difficult for spontaneity and play. Again, we're limited to all of our resources in the community, to our groups, to our events. We may have difficulties with our job and balancing our work-life flow. Again, we tend to ruminate on things that aren't in our control, and we may feel over-vigilant, we may feel irritated. And it's really important that we understand really our need to play and have joy, which is really what this one is mostly connected to. So for our last exercise today, we are going to do an imagery exercise. When I did my training in schema therapy with the Australian Institute, I got to be trained by Ruth Holt and Rita Unan. And we got to learn these imagery exercises, so I will share them with you today. Again, I will invite you to get comfortable in your chair and to kind of imagine leaving all of your pandemic worries behind. We may imagine putting our worries into a container, into a backpack or a lockbox or a treasure chest. We may imagine putting the fear we have, the sadness we have, or the anger or disgust that we have away in a container for now, that we can deal with later. As we imagine setting aside our worries and fears, we're now going to reconnect with our inner child. Inner child is an expression we use in schema therapy a lot. It's our emotional self. And so today we are going to reconnect with that inner child. So again, sitting in your chair or in a position or posture that feels most comfortable to you. I will kind of again invite you to breathe deeply. We'll breathe deeply through the belly. Again, out nice and slow through the mouth. Breathing in as you feel comfortable. Now that we have left our worries and troubles behind, understanding that there is a inner child within us that longs to play, to be creative and spontaneous, that we can now connect to that part of ourselves. We first imagine an ice cream shop. In this ice cream shop, they have every flavor of ice cream that you could imagine. Thinking back to yourself as a child, being in an ice cream shop, you can imagine all of the different flavors and things that you really enjoy or that you're maybe curious about trying. We're going to get to sample 3 ice creams now. I might first imagine picking out a strawberry, knowing it's maybe not my favorite, but something I do kind of like. We'll imagine picking out that first flavor, imagine what it feels like to hold it in our hands, As we begin to taste the ice cream, noticing the feelings and sensations you have of tasting one of your favorite ice creams, what that feels like to feel relaxed, to feel enjoyment, to really be able to savor something that is enjoyable, and that you have the choice to pick anything you want. We select our second flavor of ice cream next. I might go with chocolate. I might go with a sherbet or a mint, just to mix things up. As you imagine that second choice and having that ice cream, noticing again the feelings and sensations as you imagine tasting that ice cream, noticing how you feel, noticing that inner child within you, maybe having some excitement or joy or anticipation, knowing that these are feelings that are often neglected during stressful times. Now we imagine picking our last and favorite flavor of ice cream. I am going with Rocky Road for mine. And I'm imagining tasting that now and the textures, and invite you to also notice again the sensations, the feelings as you imagine tasting that ice cream, noticing how you feel inside. As we are now in touch with our inner child, we're now going to imagine a toy store where they have everything you ever wanted as a child. Imagining that child self that maybe always longed to have a Star Wars figure or a G.I. Joe or a Barbie or a doll set or a jungle gym or a bike or some electronic thing, some toy, something you always longed for. Imagining going through that toy store and seeing all of the different things you've ever wanted, knowing that you can pick out one of these items now from your list. Maybe it's something you actually had and that you no longer have, but you can now picture it, holding it in your hand, noticing your emotions, your feelings, the thoughts that you have, noticing the excitement or the joy that you feel as you imagine that. Imagine what you would do with that toy. Imagine what your inner child would like to do with that toy as you play with it now. When you feel you've gotten enough of this, we can slowly come back to our seminar here. Again, during the pandemic, we often get caught up into negative emotions, feelings of fear, of things that make us feel unsafe, or we feel alone and sad. We feel disgusted at times, or even angry. And these emotions leave little left for joy. And when we are able to really connect with what's meaningful to us, when we are able to identify it, when we are able to even imagine it at times, sometimes it will make us feel these emotions. It helps to ground us, it helps to center us, and it helps us to steer us towards what in life it is that brings us the most joy. So now comes for the question and answer time of our segment. So we'll take a few minutes for everyone to write in some questions. We'll answer them in just a few minutes here. I'll give everyone a chance to write some things down. I'm gonna again look on my other screen here, as technology has not been my best friend in creating this presentation. I got another computer here going, but bear with me. I'll just be looking off over here to read all the questions we have so far. So we got a couple questions so far, and we will try to answer as many of them as we can. So I'll kind of go in the order that they came in. The first question asks, do these techniques help with both anxiety and depression? And I would say that these techniques can definitely help with the emotions in general. Uh, you know, fear and sadness both have different responses. They both have different ways of coping and getting the need met. Again, I think it's most important to first just identify what the positive ways of coping with each one of these emotions are, and ensuring that you're kind of being able to do that as much as you can. Not all the techniques, I think, will alleviate people's feelings in the same way. So I think to each his own. But I think if one doesn't work and you're still struggling with one, that it's okay to seek extra support and help. And whether you're having maybe mild symptoms, and you can utilize people in your community, or maybe if you're having more severe symptoms, then you might want to go to someone that's more of a professional. I have a question about what schema therapy is. I'll just answer that again real briefly. Based on our presentation, schema therapy is a model that looks at our core emotional needs. And when our needs aren't properly met, we tend to cope with it in negative ways. We see the world in a distorted way. With schema therapy, we learn really about our core emotional needs, and we learn to get the needs met. We learn to identify our emotions from our past that are attached to not getting our needs met. And we do a lot of work with that, so we can kind of help to resolve those old emotions so that we can put in place new plans and behaviors that actually get our needs met in a healthy way. The next question: how do you say no to someone without guilt? Well, it's kind of a broad question, but I'll try to answer it as best I can. In terms of the pandemic, anyway, I will say that guilt is, a negative emotion that is associated with a past experience. Again, not everyone experiences things the same way. Some people tend to blame themselves more. Some people may kind of focus more on the externals and the other people in their life. And so it's really a perspective thing. And really, I think the best way to understand is, to be curious and to kind of get to know. But if we go back to our strengths and our virtues, if we look at what's really important to us, is compassion most important to us? Is acceptance something that's important? Is love something that is important? And if it is, and this person is someone we do want to be connected with and have belonging with, sometimes we need to really look at our virtues and our strengths and kind of learn to have acceptance of the people around us. We learn to have compassion for them. And if it's something that does impede on your well-being, then with assertive anger, again, if we're doing it constructively, we can set limits and boundaries with people in our lives. So I hope that answered your question. I have another one. Do you have any clients participating in mindfulness activities? I really love mindfulness. It's definitely a big part of my practice. We learned just a little bit about, some skills of mindfulness. Schema therapy definitely uses mindfulness techniques. A lot of imagery work that we do in schema therapy, it utilizes mindfulness. The loving kindness meditation is one that we practice today, which is practicing mindfulness. I think that mindfulness can be helpful to a lot of people. I want to preface that for people that do have mild symptoms, mindfulness and meditation is something that you can really get a lot of good resources for in the community. And there's lots of good things on YouTube. There are meditation groups, and yoga can definitely be a good practice for mindfulness. I will add again that for people that have more severe symptoms that do impact their way of life, that mindfulness techniques are best to be learned and taught by a professional. As you know, if we do have unresolved traumas, things like that, sometimes the mindfulness techniques can be provoking, or they can cause fear and things like that. So again, back to the question, yes, I do like to incorporate mindfulness as much as possible, and I think it can be a very good practice that can help benefit the lives of all those around us. It is a personal practice of mine. And I do want to share again that a lot of people think mindfulness is just simply an awareness thing where we learn to breathe and we learn to kind of see things, from a bigger picture, which is a big part of mindfulness. But there's also the kind of second half of the coin, which is the compassion piece. So with mindfulness, we're not just learning about self-awareness and how to see from a different perspective. We're also learning how to have compassion for others, compassion for ourselves, loving kindness. Again, the practice that we did earlier is one that kind of really digs deeper into the mindful practice, more than just the self-awareness part. It's also going into the compassion, the acceptance, and the love part, which I think really completes the full mindfulness practice. If we have difficulties expressing love, sending love, or receiving love, we may be critical of ourselves. We may be more inclined to have anger. We may be more inclined to be in touch with negative emotions. And I think mindfulness is a great practice to have the awareness, but also the self-compassion. All right, have another question. Meditation is too hard for me. What can I do? I think that is a very common experience for a lot of people, especially when we're first starting out. Mindfulness teaches us that there is a non-judgmental awareness that we begin with, which we begin to observe our existence. We begin to observe ourselves in a non-judgmental way, not saying something is good or bad. And that basic skill of mindfulness, of recognizing when we're judging ourselves, recognizing when we're having thoughts that are stuck in the past or we're preoccupied with the future, this self-awareness, if you're becoming aware, you're doing it right. So basic mindfulness is not a right or wrong. As far as kind of going into some of the deeper techniques, as far as letting go and going within and noticing emotions, I think that can be something that we really need a guide for, especially, again, if we do have symptoms that are more impacting our way of life and our well-being. In those cases, it's often encouraged to work with someone that is a professional, someone that can help to kind of work with you through the practices, help you to navigate what's going right or what's not going right. And, again, the more that person practices themselves, the more they'll be able to hand that to you. And hopefully they have some loving compassion as well, because really sometimes if we feel we're not doing it right, it may be attached to feelings of not being good enough. And again, we have to offer ourselves compassion in that we are just learning or that we're just starting off. All right. Another question. How do you positively respond to negative remarks? So I'm going to assume this is kind of more in the context of the pandemic. So, it's very difficult in the pandemic that we have a lot of tribalism. We have a lot of kind of groups that tend to be against one another. Definitely, there's lots of tension with politics, and there's lots of tension with, these people are doing the wrong thing. These people aren't following the right rules, or these people are forcing something on me. And it's, really difficult when we have such opposing views. And I think what's really important, again, is that we go back to our values. We go back to our strengths. We understand compassion. We understand acceptance. We understand, really being modest. Okay. There are a lot of things that we as people can agree on during the pandemic, and that is, I am afraid, I am alone, and I am disconnected. And while we may not agree on all of the kind of ways to deal with the pandemic, I think it's important for us to find a common ground so that we can show each other respect, so that we can show each other compassion and kindness. Again, these types of things help to alleviate negative emotions like fear and anger and disgust. And again, I think fear, anger, and disgust is so prevalent in the pandemic. And really, whenever we have a traumatic experience, we're going to be more likely activated in these negative emotions, especially if we've experienced them in the past. And again, that's why it's so important, I think, to be connected to people who are supportive. Again, we won't always agree with everyone, but we can maybe still find ways to join and connect, agree to disagree, so to speak. And again, I think kindness and compassion is the high road to argumentativeness, insults, things like that. And again, we can't control everyone. We can't control the behaviors of people that don't have our same perspective, but we can treat them with the respect and the compassion that we wish we would have. Okay. The next question I have here is about PTSD. And if a person has PTSD, could these techniques help alleviate their past? I would say that PTSD is something that is really important. If you have like a diagnosis like that, that you are working with a mental health professional, because oftentimes there are re-experiencing of old emotions and feelings. There is avoidance. There is flashbacks that can happen with meditation, especially if we have PTSD and trauma and we don't have a guide to help us along the way. Sometimes it can actually make our symptoms worse, exacerbate them, things like that. With the right professionals, especially someone that is trauma informed and someone that does have special training in trauma and PTSD, I think it's very important that we do kind of work with someone to help us to understand and use these techniques. And obviously there's other treatment modalities, and there's other treatment methods that I think are more designed for PTSD. So I hope that answers your question as well. All right. I have another question here, and it is asking, I'm not into individual therapy. Do you do group? Well, I am currently training in schema therapy for groups, and I'll be completed with that pretty soon. At that time, I'll likely be having a group. I will say that it often is recommended, however, that individual sessions kind of do occur before a group. And the reason that is because we really want to identify our problems. We want to really identify what it is we want to work on. Again, I use schema therapy, and that would be the group that I'd be offering upcoming. And our model specifically would do individual sessions first, because it's really important that we understand really what our problem is, what we want to achieve as a goal. And if we go into a group not knowing that and not knowing exactly what it is we want, again, sometimes it can not have the best outcome. I know that there are likely other groups, though, that you maybe could seek someone on to see if there is a group that would work with you there. But in my experience, I think it's important to work with an individual therapist. But it all depends on your circumstances. It all depends on your symptoms. And again, if your symptoms are not as severe, maybe you're more interested in group for the need of connecting to people, and maybe you don't need as much intensive work on self. Maybe group could be something that you could do outside of individual therapy. All right. I think that concludes the questions for now. I'll wait to see if there's any last ones. And if anyone typed in a question and I didn't fully answer it, you're definitely welcome to do a follow-up question if you'd like to, and we'll just wait another minute if anyone wants to do that. While we're waiting, I have my works cited right here. Again, if you're wanting to learn more about the Atlas of Emotions, you can go to the website. If you want to work on your character strengths, identifying those, the VIA Institute on Character does have a character strength survey that's free. And the meditation we did, the loving kindness meditation, was from the Greater Good in Action. And you can Google that if you're wanting to do that meditation as well. Otherwise, there's a lot of good meditations online for loving kindness meditation. All right, well, there's no other questions. So I want to thank everyone for attending this webinar. We will have a full online workshop that will be happening Saturday, December 4th from 10 a.m. to 1 p.m. We'll be expanding on some of the concepts we've discussed earlier. Again, we'll be focusing on more needs as well as having more techniques that we can use to get these needs met. Contact information if you want to contact us. There's a link here. You can book sessions with me. You can send a question if you'd like as well. Again, I'm currently taking people for individual therapy and couples, and I will be starting a group very soon, hopefully, in the next month or two, as I'm just completing my group schema therapy training right now. But I want to thank everyone for attending today. It's been a pleasure to get to share with you some of the things that I have found helpful for myself and for my clients. And hopefully this has given you more perspective into what your needs are, maybe ways your needs aren't being met, and more importantly, ways to get your needs met. So thanks for attending today, and I'll look forward to speaking with you all again soon.